Welcome to this episode of the Voices for Voices TV show and podcast. I am your host, founder, and executive director of Voices for Voices, Justin Allen Hayes. Thank you for joining us today. We are very grateful for you joining us, whether you're watching or listening or reading our transcripts. We are, again, grateful to have you with us. We are marching towards that total show of 300 for that we're going to hit by the end of 2025 here. So we're excited to be filming additional episodes, different places, and just love sharing information with you to try to help go towards that goal of helping 3 billion people over the course of my lifetime and beyond, in which we don't know exactly which individuals or where they're at, but we know that experiences are reaching far and wide. 50 countries, 530 cities. We're really just blown away. When we started this, we didn't know. We didn't know where it would be, where it would go, and here we are. So for this episode, we're going to talk a little bit about being healthy, not being 1,000% watching every single thing that we eat or watch every single thing that we purchase, because this isn't just about being healthy as an individual, as a human, what we consume, food, drink. This is also about things we buy. So this camera that you're watching on was more than likely manufactured somewhere other than the United States of America. Just like we have our phones, right? There's lots of components that go into them. Not all components are manufactured in the United States of America, which what we're talking about here for this episode, it could be your country, your home country, if you don't live in the United States of America. Things that you consume that are manufactured, made in your home country. That's really what this is about. So this, we talk about this really on two fronts. So we have the supply chain. So right, I have an OtterBox case on my iPhone, and there are different components, parts that go into making those two products here for our discussion. And so that means, right, we don't have control over it as a country 100%. We believe that what we are purchasing is indeed what the title of the product, the description, and then the components that go into that. And so we kind of it's just one of those subconscious things. We just assume that that's the case, and sometimes that's not the case, or sometimes parts, materials, components are not made in the highest quality, and that can mean a bunch of things. Excuse me. But for this purpose, when we're talking about making the best quality, that 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 can mean, right, there's quality control, right? There's supposed to be these governing bodies that are supposed to be checking, making sure if three particular ingredients are in a particular product, that those three ingredients are indeed in those products. If there's two, that there's two. And not just that there's two, but it's the two that are laid out in the packaging, or online if we're doing an e-commerce purchase, which a lot of the things that we do, a lot of the purchases that we do make are e-commerce. And so our supply chain, again, I'm gonna talk about here in the United States, that whether they're things that we consume, that we eat, or even this beautiful, wonderful Voices for Voices t-shirt is not made in the United States. And so again, I'm assuming that the cotton, and then if there's other materials that go into the t-shirt, that's what they are, that they can't hurt me. And so that's kind of where we're going with this. Are the things that are said to be in the t-shirt, the iPhone, the OtterBox, the camera, are those indeed the case? The case, talking about OtterBox, I see how that goes. It sometimes happens. But then, are they healthy? And I'm not talking about 100% healthy, as I mentioned at the outset. I'm talking about they're not going to hurt us. They're not going to cause us great bodily harm. That's what we're really driving at. And when we source, fancy word, source, was where we bring many components or a couple components together to make a thing, to make an OtterBox case, to make an iPhone. When those are made outside of our home country, we don't have control over that supply chain. We may have control over ordering the components, such as I'm going to order 3,000 components because I'm going to make 3,000 phones. That would be an example. So when those 3,000 components do arrive, that those 3,000 components are exactly what we, as let's say a purchasing department, that's what we ordered, right? And when we don't have oversight, and we're not for complete oversight of every single thing, but there are things, right, that we talk about food and drink, those things we ingest, and those things could be harmful to us just because it's in a pretty package, because the logo is a logo that we have seen many times before, or we've heard about, we've seen a commercial, we've heard friends, family members, significant others. And so we just assume that, well, that's what we're getting. So there's that healthy, meaning we're going to continue to live side, talking about the food products, but just as easily there could be some types of components, materials that could go into clothing that could still have a injuring effect on the body, right? Because we're wearing a t-shirt, It's right against our skin. And so if there is something that's not supposed to be there within the t-shirt that could blend and soak into our skin, into our blood, and you can see where things go. So that supply chain is really the goal of what we're really getting at today, because we want everybody to be healthy. We want everybody to survive as long as humanly possible. And I can say, as living here in the United States, again, from the shirt that I'm wearing to the case that's on my phone to the camera that is filming and recording, there are a lot of products that are made in China. And a lot of that comes down to cost. We as consumers, we have grown accustomed to inexpensive products and services. And we can look at our mom and pop shop pricing versus our big box pricing. And when we see that difference, ultimately at the end of the day, it's about convenience for the big box because there's lots of products and services there. And then it's about quantity. They're purchasing in much larger quantities. They're able to get price reductions. And so the supply chain of product A versus product B is really something that it would take a lot of time as us individuals to really dig into. It takes a lot of time to research these things, right? You put the name of the product, and then you put all the ingredients, and then where each ingredient was sourced from, whether that's the country or the state or territory or province. And easily we can see that there's a lot of sourcing of components, of materials and ingredients that are outside our country. So we can move on from this health type of discussion to the supply chain of the products, whether we ingest them or we eat them, whether we drink water, drink a soda, drink an alcoholic beverage. I don't consume alcohol anymore, but that's beside the point. And so these ingredients are coming from all over the place in search of having, in the mind's eye, having the best product and service at the lowest cost. And oftentimes, those components, that final product does not come from our home country. That's just the way it is. And I don't think there's really an argument on that. We understand that, but we still continue to search for that lower and lower and lower and lower and lower cost product and service. Not really as concerned as we should be for not only the working conditions, but how much control a government, in this case, a lot of products, t-shirt made in China. China is an adversary of the United States and of other countries around the world. We love our Chinese followers, our listeners, our viewers. We love all our viewers and all our listeners and all the readers of our transcript. But regardless, we're foes, right? So on a national security standpoint, when wars break out, and whether those are trade wars or military wars or intelligence gathering and spying and all those, Uh, Other countries do that. All countries do that on some level or another. And so when we have, and right, this is a deeper discussion as we're talking. We have, we have friends, but even our friends at some point could still be competitors. Product A versus product B. The label might be a little bit a different color, the logo might be a little different, but we still can be competitors. And so we can think of like that with, here in the U.S. and put throwing out China just as an example. But there's products and services made and components made all over the world. But we just know that there's a lot made and a lot of sourcing. It's coming from China. So that supply chain where we're searching for the lowest cost and the best quality, when an adversary is making and having components that go in, or the final product comes from an adversary, there could be a big problem with the supply chain. And we're not going to talk about all the products and services and food and drink out there. But just suffice to say that there's a lot of products and services and foods and vitamins. That's another area, right? So take a multivitamin or take a vitamin C, vitamin D. Where are those elements? Where are those components sourced from? Again, it's under the same banner of want the best quality at the least expensive price. So we want to pay less for a product, but yet we're searching and seeking the results of what we're looking for. So we're looking for vitamin C, we're looking to help boost that immunity. We're not looking to ingest chemicals, dyes, so forth. And so that's a big thing, right? I think so. I'm 43 years old, and it's mind-boggling when we look at around the house or around the dorm or around the condo or apartment, how many things we have, number one, but then where are all those things coming from? So we just got to be cognizant of that as an individual. So whether you live in the United States or not, doesn't matter. Your home country, that's really what we're looking at. So you'd be more, I'll say more happy, more comfortable knowing products and components if those are 100% sourced in your country, just as I'm talking here in the United States, the same thing. That's really what we're getting at. And when we bring, other elements from other companies, other countries, other areas, maybe they have the same quality processes in place. Maybe they don't. And that's just one area. So if they don't have the quality processes in place, that could potentially mean that some of those components, elements, or ingredients may not be healthy or the healthiest, the best. That there could be, maybe even if they're not looking for it to be dangerous, but it could be. And then when we layer on top of that, if the home country is a foe or a competitor, let's call it, to where those products and services that those are being exported to, such as here in the United States. So product services, product components, ingredients come from China, the United States. Whether we assemble them here in the United States or whether they come together, they're coming off the boat, off the plane, off the train, off the truck. And we really hope that the quality controls are happening at every step of the way. But just as life is, that's not always the case. And so that's a concern why I wanted to put this content out, that we should keep our eyes out. And so we have RFK, right? He's coming in and he's looking at foods and ingredients, and he's looking at Coca-Cola, and Coca-Cola is a huge organization. And if you look at the ingredients in Coca-Cola in Europe versus here in the United States, you're going to find ingredients here in the United States that you wouldn't find on the label in Europe. And so that's really where we're going with this. So the least amount of ingredients, depending on what it is, right? It's not really about the least amount of ingredients. It's about those ingredients being pure and as organic and, as pure as they can be. And we start adding ingredients that look at your shampoo, look at your label there. See how many ingredients are in your shampoo. How many ingredients have more than 5 or 10 letters in them? How many are we able to actually say? There's a lot of ingredients on a lot of different products that I don't know quite how to say them correctly. And so that's a problem. It's a big problem. And so an RFK comes in, he's searching, he wants people to be as healthy as can be. And so even before he's come into the administration, red dye was banned here in the United States. Can no longer be used in products. So I'm guessing that there was something bad about red dye that wasn't exactly on the up and up, but it was being used in a lot of different products, potentially foods, drinks. And so that was really the alarm bell. We can, have those discussions about vaccine, no vaccine, this and that. This discussion is not that. This discussion, we're talking about supply chains and who has control over them. If a product is 95% made in China, then that means that the home country of China has 95% control over that product, the labeling, and all those things. And we have in our home country 5%, which is the unloading off of the truck, and then the purchasing, opening, and consuming that product, or whether we're wearing it, as we're talking about t-shirts here. So it's important that we have these discussions. Some of you might not want to hear it, and it's not the most glamorous thing to talk about, but I think our health and well-being, we really need to think about that. We're talking about competitors on a global scale, U.S. and China, U.S. and Vietnam, wherever these products and there could be rare earth metals that are in certain countries that aren't in our home country. So we may have no other choice but to purchase those rare earth metals. And some of them, I believe, go into mobile phones. But having some oversight on that would not necessarily be a bad thing. because I think we could all agree that we value our we value ourselves and our families and our children, our nephews and nieces, grandparents, great grandparents, aunts, uncles, the whole board. We really have a concern that what we're consuming, what we're wearing, is not going to hurt us. It's not having the oversight of a country, an organization that has those ulterior motives. And I've taught marketing and business for many years. The goal of an organization and business is to make money, period, full stop. So the way organizations make money year over year is they have to reduce costs. So that could be reducing the quality of the product in many different ways. That could be adding a couple fillers here and there. Again, we can we'll talk about on a future episode about how there is still another layer onto this. So be on the lookout for kind of the second part of this episode, because it's important to cover. We're getting close to time, and I don't want to leave it out. It's just that important. So we want to have as much control, oversight of the products, just whether it's food, drink, whether it's clothing, whether where we live. The asbestos was a huge problem. Got a lot of people sick, a lot of people really sick over the years, and so we just need to know about this. And I think banning that red dye was a big step in that direction here in the United States. And there could be big things, and there are big things happening in your home country that are most important and really important. But maybe your country is importing a lot of different products and foods and ingredients from other countries as well. That's why we're having this conversation, is to just lay it all on the table and think about it. That if a competitor wanted to be not good, they could put things in to products that could hurt individuals, whether that's right then or whether that is over the course of time, where the traceability might be a little bit tougher. So that's really where we're at here. So we touch about the health, the supply chain, that our products aren't wholly in our hands from a supply chain. That in the United States, lots coming from China, lots coming from other countries overseas. But we as a consumer, we've been demanding lower cost. And are we at that breaking point where that's starting to hurt us as a human population, that we're such at a hunger, a thirst for the almighty dollar, the almighty euro, the almighty yen, whatever your currency is? And that's what we really need to think about, and why we're talking about this. So for us to ban, red dye, that's huge. Any way we can make a step in a positive direction, that's also huge. Very, very important things to do. They might be more important or less important to you or me, but it was important to have this conversation, just to talk about that supply chain, how we don't always have control over that, and that that could maybe in the end hurt us, especially again from competitors that in the end they may be trying to hurt us. So let's hope that's not the case.